Hello, my name is Dr. Maria Iliakova. I'm a bariatric and general surgeon and specialize in helping people lose weight through surgery and treating related conditions. There's been a lot of buzz in the news lately about weight loss medications. You may have heard of some of them, especially celebrities taking and endorsing some of them. I figured it'd be a good time to actually have a discussion about weight loss medications from me as a specialist in this field. So today we'll be discussing weight loss medications that can help you lose weight. First, we'll talk about what medications exist. Then we'll talk about what to expect and how they work, some limitations of these medications, other options for weight loss, and a caution about making sure that what you're taking is actually approved for weight loss and has some data behind it. So first of all, weight loss medications, also called anti-obesity medications, have existed for a really long time. There's technically, however, only 9 medications that are approved by the FDA, or Federal Drug Administration, to be used for weight loss. These are the medications that actually have a lot of scientific data behind them and are approved for use for weight loss. That also makes a difference financially for people because it means that an insurance company is more likely to actually help pay to cover these medications and treatment using these medications than anything else. So what are these medications? Well, to be clear, there's 4 classes of medications into which all 9 of these medications fall. So the very first one is Phentermine or Adipex P. Also in that class is Phentermine Topiramate or Qsymia. Another class of medication is Bupropion and Naltrexone, named Contrave. Yet another one is Orlistat, also known as Ally. And the last class of medication is what's called GLP-1 analogs, and that contains liraglutide, also known as Saxenda, and semaglutide, also known as Wegovy. Semaglutide is also used at lower doses to treat diabetes and called Ozempic, which is the one that's really been in the news lately the most. So let's go ahead and go one by one through these medications and talk about them. So Phentermine, or Adipex P, is probably the one that's most familiar to a lot of people because it's been on the market one of the longest. This is a pill that you take once a day, and it can be used for up to 3 to 6 months, depending on the provider that's prescribing it for you. And it's a very effective appetite suppressant. It also helps to regulate your fullness and satiety, and in general can cause your metabolism to be a little bit increased over your baseline. It's a stimulant medication, or what we call a sympathomimetic, and it actually has some pretty bad side effects in some people as a result of this. It can cause heart palpitations or even heart attacks, irregular heart rhythms, high blood pressure, headaches, insomnia, and dry mouth. So the most important thing before even starting this medication is to make sure that a patient doesn't have any of these other problems, which could be made worse by this medication. The next is to make sure that my patients have an EKG before taking this medication. An EKG is stickers placed on your body to do an electrical study of your heart. It's non-invasive and only takes a few minutes to do, but it can really make sure that we're not missing an irregular heartbeat, which could be made worse by this medication. So this medication, like I said earlier, is really important to avoid in people who have heart disease, high blood pressure, anxiety, insomnia, any kind of funny heart rhythms, and with some other medications. So it's really important, as with all of these medications, that you're prescribed this by a doctor and somebody who either specializes in treating patients for weight loss or who has done this for a very long time. The maximum amount of time that I allow my patients to be on this medication is 6 months, because otherwise it becomes too unsafe for people's hearts and nervous system. The other medication that I mentioned earlier was Cassimia, which is a combination of Phentermine and Topiramate or Topiramate. It's a long-acting medication that you also take once a day as a tablet, and it ramps up from a lower dose to a higher dose over the course of several weeks. People can stay on this medication also for 3 to 6 months for the exact same reason as Phentermine, because it contains Phentermine. This medication, just like the other, works in a very similar way, but because it contains Topiramate, actually has a lower side effect profile and may be safer for people, causing less anxiety, headache, insomnia, high blood pressure, and those heart palpitations and other heart symptoms. The downside to this medication is that it's a bit more expensive than Phentermine, which is the cheapest medication and most widely available anti-obesity or weight loss medication on the market. Qsymia can be pretty expensive out of pocket if insurance doesn't cover it for you. Many people's insurance does not cover weight loss medications, so it really depends on your plan and what's affordable for you if this is a good option. So the next class of medication is one called Contrave, which is comprised of 2 medications called Bupropion and Naltrexone. Just like Phentermine, this one is also used for some mental health conditions. Bupropion is used for addiction treatment, helping people stop smoking, many other things as well, like anxiety and depression treatment. With this medication, it's also a once a day tab that you start off with, and then you ramp up eventually to taking 2 tabs twice a day over the course of about a month. This medication is originally used as an antidepressant. It also blocks opioid receptors or things like narcotics. It's used against that at different doses. And it really helps to suppress people's appetites as well and to make them feel fuller faster. The side effects of this medication are a little bit different than Phentermine. While it doesn't have the same effects on the heart in terms of causing funny heart rhythms, it still can cause the heart rate to be fast. It still can cause insomnia. It still can cause dry mouth, headaches, high blood pressure. And this one has a higher rate of causing nausea, vomiting, and diarrhea, sometimes even constipation. So it's really important that people who don't have really high out of control blood pressure or heart disease, really important that folks with those things do not start this medication. Some people are also taking bupropion in the form of Wellbutrin, and so that's definitely a discussion to have with your doctor, whether or not this medication would be appropriate for you if you're taking that medication. So typically I put my patients on this medication once a month, and I leave them on it as long as they're losing weight and doing well with it, not having any of the side effects. I leave it on for a maximum of 12 months, and I want to make sure that at every visit that folks are losing weight when they're taking this medication. It's also important to taper this medication, meaning to slowly take it off rather than just cold turkey, because you can have some pretty gnarly side effects from that as well. By the way, with Phentermine, just to go back there for just a moment, Phentermine is a medication that I use pretty frequently for medically managed weight loss, but I do see those patients once a month in person to make sure that they're not having any bad side effects and that they're still losing weight. If at any point a patient is not losing weight on this medication, we consider stopping the medication at that point. So the next class of medication is called orlistat, which is a lipase inhibitor, meaning, by the way, it's also called ally. So it stops the body from absorbing fat. So any time that you're eating something that contains fat, that will pretty much just go right through you. And so people who take this medication have side effects such as greasy or fatty stools. There's also a pretty awful side effect of what's called anal leakage. So you can actually leak oil or leak fat from your bottom when you're taking this medication. Another really important thing to consider is your body actually needs fat, needs to be able to absorb fat overall. So especially folks who need vitamins A, D, E, and K for things like blood clots, forming blood clots, or if they're taking blood thinners with some other medications that they're taking, this is a big no-no in some situations. So again, really, really important to talk to your doctor about whether or not this medication would be appropriate for you. This one, in terms of the rest of the weight loss medications, is kind of in the middle in terms of cost. So it certainly can be appropriate for some people. It's a medication that's taken by mouth 1 to 3 times a day, and it can be used for the long term, but depending on how well you tolerate it and whether it's appropriate for you or not. The last class of medication is called GLP-1 analog, or medications like liraglutide and semaglutide. Liraglutide is also called Saxenda, so you may have heard it named that. And then semaglutide is also called Wegovy. Wegovy is the higher dose formulation of this medication, also known as Ozempic. So Ozempic is not FDA approved for weight loss, but Wegovy is. They're technically the same medication, just at different doses. So this medication started out as a diabetes treatment, and people noticed, doctors and patients, and eventually researchers noticed that patients on these medications lost weight. And how is that? So it treats diabetes by actually helping to improve glycemic control, kind of regulating the highs and lows a little bit better. It helps people be more susceptible to insulin and not develop insulin resistance as much, which is really important in the metabolism as well of foods. And it also helps to suppress appetite, just like the rest of these medications. So this, differently than the other medications, is actually injectable under the skin, and most folks inject it into their thighs or other places where they have a little bit of extra tissue. You inject it once a day, and you ramp up from a lower dose to a higher dose, eventually a maintenance dose that's about 4 to 5 weeks after you first start taking it. This medication can have some really intense side effects associated with it, especially nausea and diarrhea are the biggest ones. Those are usually at their worst at weeks 2 to 4 when you start taking these medications, and they, for most people who have these symptoms, get better over time. However, sometimes those symptoms are bad enough or just completely not tolerated by patients, so I actually have to take them off this medication and start something else. For this medication, there's a really, really important black box warning. If you or a family member have ever had a history of thyroid cancer or any associated problems, this is a complete contraindication to this medication because it can actually increase your risk of thyroid cancer. Some other side effects of this, just like the rest of these medications, are things like high heart rate, headache, and not surprisingly, since it's a diabetes medication, it can actually drop your blood sugar too low as well and cause what's called hypoglycemia. So this medication can actually be used in the long term. I don't have a specific cutoff time for this, unlike the Phentermine and some of these other medications. But again, with all of these medications, it's really important to be monitored by a doctor who knows how to manage weight loss and weight loss medications and can discuss the full spectrum of treatment options for you. So these medications, I hate to tell you, are not a magic bullet. All of them are best and most effective when they're used in combination with diet changes and with physical activity. They're also really important in the context of having all of your other medical conditions treated as best as possible, and mental health as well. So you really have to be in the right mind frame to be able to make lifestyle changes, which is required for all of these medications to be at their best. Another big limitation of these medications is that we're just talking about excess body weight. So let's say you have 100 pounds of excess weight on you. Not all of your weight, but 100 pounds of extra weight above a BMI of 25. So these medications can only help you lose about 5 to 20% of excess body weight. So if you're let's say if you're 300 pounds and 100 pounds of that is extra weight based on your height and your body, you would only be expected to lose on these medications about 5 to 20 pounds. As you can notice, that's not very much weight. That can make a significant difference for people in terms of their overall health and how they feel and how they perceive themselves. But it's not the drastic weight loss that's sometimes promised by scams and gimmicks and things like that. There is no medication that can help you lose more than that reliably. The other limitation of these medications, of course, is that when you stop taking them, they stop working and they can't help you lose any weight after you stop using them. So there are these limitations. It's really important to know these limitations before you start taking them so that you have expectations of what you can actually achieve with them. So what are some other options for weight loss if these medications are limited? Well, certainly there's lifestyle changes, but lifestyle changes also have limitations in that they, one, don't work for everyone, and it's really hard to make them life-lasting, long-lasting. In fact, over 95% of people who are overweight who try diet and exercise alone will regain weight. So it's not a very effective way of doing it. I'm also a surgeon that specializes in weight loss surgery, and that is, by all of the evidence, by all of the studies, all of the experience that we have, surgery for weight loss is the most effective treatment for people who are overweight to achieve weight loss, and it's definitely the most long-lasting as well. That's not to say that these medications don't have a really important role in overall weight loss and weight management. They can help people before surgery, after surgery, without surgery, and certainly in combination with diet and exercise changes, they can really make a big impact on people's lives. So I hope that you consider this information, and I hope that you consider seeing a bariatric specialist or a weight loss specialist. I am one of them. I'm in the Iowa City area and work at Mercy Iowa City in the metabolic and bariatric surgery program as a surgeon, and also in doing medically managed weight loss, which is what we've covered today. I also hope that you take to heart that there's lots and lots of things out there that say that they can help with weight loss and that promise things, but I wouldn't waste your money on those things. There's no data behind them, and unfortunately, anything but these 9 FDA-approved medications really have no data behind them. So you're just kind of wasting money and wasting time by using those medications or other things on offer. Unfortunately, there's no specific tea or food or any product out there that can specifically help you lose weight other than these 9 FDA-approved medications. So I really hope that this was useful to you. If you have any questions or would like some more information, please get in touch with me. My name is Dr. Maria Iliakova. I'm a bariatric surgeon at Mercy, Iowa City, and I really hope this information was useful to you. Take care.